Inspire, motivate, challenge.
Well, you talk about satisfaction and self-satisfaction, and among healthcare professionals generally.
Yes, please.
So I mean, just to write on that.
Yeah.
I'm sure you've noticed there's a very, very common trend of pharmacists, doctors, and other healthcare leaving the country now.
That's correct.
So I really like to get your opinion or perception on that. Like, is that a good trend? Is it a trend that you advise people to take on? Just talk about it.
I will answer in this way. It is estimated that about 40% of Nigerian pharmacists are outside the country. They are seeking for greener pastures. Immigration generally is usually governed by the principles of demand and supply. So there's a tendency for pharmacists to desire to go to places where they are on demand, but not just on demand, but where they are treated, where they are better, where they are celebrated better. Failure to stay here has to do with what I consider remuneration and conditions of service. You see a student or a graduate of pharmacy who had cost to go to school every day, 6 days of the week, including Saturdays. That is the only profession in the world where you can score less than 0. In pharmacy, you can score minus 60, if you remember.
Yeah.
And so it's a course whereby your average for the session may be a first class. Your total average grade for the session may be a first class, or aggregate 5, all over 5. But yet, you have to repeat because you didn't do well in dispensing. Just one particular course. Now, as a result of this, when pharmacists graduate, the expectation is very high. They want to be given freedom to practice what they've learned. And then they get into hospitals. And they are constrained by the lack of space for expansion, by lack of some hospitals are so parochial and so myopic that they don't even allow pharmacists to do ward round. Something that's supposed to have helped every other healthcare professional and the patient, knowing fully well that there's usually medication errors that do occur, either as a result of prescription or as a result of self-medication. And it is when the pharmacist is able to talk to the patient that all this can be discovered. And people have forgotten that the same pharmacist who play a very key role in the discovery of the medicine, in the development of the medicine, and who play primary role in educating other healthcare professionals on the pharmacology of that same medicine, cannot be asked to come and work in the hospital, and you are now only restricting his role to dispensing. That is, you are overtraining somebody and underutilizing him. The society is the loser for it. In addition, the morale of that kind of person is going to be affected. So that's why they go to other climes where they are given opportunity to play their critical role as clinicians, clinical pharmacists. Unlike in Nigeria, where the mindset of some of the healthcare professionals dates back to 5 centuries ago, when pharmacists were still dispensers. Pharmacists are now being trained for a period of 6 years post-A levels. And so it's not the same kind of people who were trained 5 centuries ago. Yeah. The role had been enriched, and if anybody does not understand that, then that is short-sightedness. That is lack of education. And I think that's the reason why Nigerians are losing a lot of these young pharmacists into other countries.
That's well said. We can all talk about the structural deficiencies that we have in the country.
Yeah.
So whether it's pharmacy, medicine, everything, there will be a sense of underutilization.
That's correct.
But I'm even talking about, let's say, even beyond the healthcare industry, professionals now
generally
have similar career paths like you had in Pfizer, getting to director or not, and they are still leaving the country.
That's correct.
So I just what's your perception about that?
Yeah, what happens usually that countries go through various phases. Nigeria is going through a phase that requires perseverance. I'm one of those who believe in the future of Nigeria. I had the opportunity to leave the country, first in 1996, second time in 2006 after I left Pfizer, but I refused. And the reason is that I believe that Nigeria has great potential. And the cost of living in Nigeria is lower than that of Europe and America. That's the truth. And it's not all that glitters that is gold. And if everybody leaves the country, who are those who will be willing to take Nigeria to that promised land? So we've got to have a group of people who are patriotic enough to stay, to go through whatever it takes. Of course, there are people who just look at some of the temporary things in this country and they use that as basis to make a choice to leave. I cannot blame them. But for those of us who see beyond the challenges today, we see a bright future, because there's usually light at the end of a dark tunnel. And in most cases, you yourself can actually be the light in a dark tunnel without even having to wait till the end of the dark tunnel. For those of us who stayed in the country, we are not doing too badly. We are surviving. Not just surviving, we are thriving. And we are beginning to help to transform the system for the better, so that those coming behind will not have to go through what we went through. I believe in the future of the country. I believe that those who are living because of lack of professional fulfillment, not necessarily because of money alone. But if money is one thing, but when you do not have professional fulfillment, you are not able to really practice what you've learned, what you spent years learning in school. It's a major area that I think that if government takes best care of, the professionals will stay more professionals will stay in Nigeria. Look at what professionals are being used to do in a place like America, where community pharmacists are actively involved with vaccination, not just with COVID, but also routine vaccines. They play a very critical role. So in Nigeria, we are yet to get to that place. Thanks to the National Primary Healthcare Development Agency that has now accepted trained pharmacists as vaccinators, and for community pharmacists to start to do vaccination on COVID. What will be ideal is for community pharmacists to be allowed and recognized like the private sector contribution of primary healthcare centers, so that they can participate actively in routine immunization. In that way, large chunk of Nigerian children will have access to immunization. Two, because they know their community better, once there's a particular case of unimmunized child, it can easily be tracked, can quickly track it, you can quickly name the problem on the board. And so community pharmacy practice become much more fulfilling. And so this is the way to go. And government cannot provide free health services to everybody. So as somebody who served on the board of teaching hospital, Lagos State University Teaching Hospital for 8 years, I can tell you, the teaching hospitals are overburdened by cases that shouldn't have gotten to them. There are cases that can be handled at the primary healthcare center, that can be handled at community pharmacy level, that can be handled at general hospital level, which is more like a secondary level of healthcare provision. Instead of people going straight to teaching hospital to go and treat malaria, headache, simple headache, and so on and so forth, or skin rashes, which has not been exposed to any of the people at the primary level and secondary level. So a teaching hospital is supposed to be a referral center, not supposed to be a place that everybody goes into. And Nigerian government will do well if they pass laws that make it mandatory for people to first of all go to primary healthcare centers or community health pharmacies, and on referral, they can now go from there to general hospitals. And on referral from general hospital, they can go to teaching hospitals. So only cases like accident emergencies should go straight to teaching hospital. So this is the way we can restructure our healthcare. And I do not know what are the peculiar challenges for policymakers, why they have been unable to just understand this simple flow. It's an operational thing, and it doesn't require rock science to understand the fact that we are overburdening the teaching hospitals by our failure to make guidelines that are strictly followed from primary healthcare to secondary, from secondary to tertiary.